Welcome to Point podcast with Robert and Tony. And we're glad to be back again.
Good evening, everyone.
Good evening. You can't see out my window, but it is nighttime. You can see the magical unicorn here, though.
Oh yeah, unicorns. My daughter's like unicorns too.
Yeah, she's at that age. So somebody set it up like that up here. I don't know if it was my daughter or my son. They thought they were being funny. But I think I had it there during some of the earlier podcasts where I had it here in the corner, just looking around the chair. I thought that was kind of funny. I think next time, for each time I do the podcast, I have to move the unicorn somewhere. That's the game from now on, is everybody has to find the unicorn.
So today we're going to talk about Robert.
Well, we have a few topics that we've been wanting to discuss the last few weeks. And just before we started the podcast, we started talking about ethics and emotions, which I thought was rather interesting. I'm not sure how well they go together, but in a way of dealing with people, whether it's work or friends, acquaintances, and such, it's been interesting to see how much your current demeanor or how you're currently feeling at that time will impart over to the other person who you're speaking to. This is actually a great example because I remember back to my clinic days where all of us were kind of very fresh. We didn't really, know anything. A lot of the clinic directors, we were so amazed at how much knowledge they had and how confident they were in doing these treatments for the patients. And I remember having a discussion with one of my teachers. They said that you should never show not having confidence when
Mm.
treating a patient, because the patient is coming to you for a treatment. They're looking for a way of getting better. And if you're showing a type of negative emotion, they're going to see that and they're going to think to themselves, well, maybe they don't know what they're doing. This isn't somebody that I want to spend my time with, you know. And it's interesting because throughout the years that I've been treating patients, we have a type of compatibility with people as well. We get along with some of our patients better than we do with others. We tried to give them the best care. We act the same way towards all of them. But some of them are very, very resistive because that's the way they are. Some people are very acceptive because that's the way they are. And then there's some people who you can never reach, no matter what you do, no matter how much you work with the patient, no matter how much extra you do with them, it's just never enough. And it can be disheartening sometimes, but nothing, I can't do anything with it. But I want to say this though, lately at work, it's been very difficult to deal with people because you're dealing with a lot of issues. You're dealing with a lot of people coming up to you saying, what should I do for this? What should I do for that? This is an emergency. This is something you have to do immediately. And it just keeps piling and piling and piling up. And eventually you just look at the person and it's like, I don't want you to talk to me anymore. Either they'll understand because they've seen you having this wonderful downward spiral, or they'll turn around and snap back at you because they've been on a downward spiral too. And I was thinking about this. I says, someone once said that you should never treat a patient while you're angry. And it's not angry at the patient, just being angry in general. And I actually agree with that because they can see that you're angry and they'll begin to wonder whether or not it's a good idea that you're treating them at the time. So these were my thoughts to it. So I wanted to ask you, what do you think of this? What do you think with emotions and treatment?
Um, Emotions. of course, it's a major thing for us as a practitioner. It's not just be angry. Any emotion, other than happiness or positive
Yeah,
emotion,
positive emotions. Yeah,
negative emotions, no matter what, they will sense it, sense everything you doing.
yeah,
The thing is, for our treatments, we actually make direct contact with patient's body. They might think, "Oh, I just put a needle; it's okay." They can actually feel, even though the patient like facing down, if they don't see you coming in or not, if they get ready for treatments, they know who's coming in.
Hmm.
And they know if you're happy or not yourself anymore. Why? It's because if someone who get treatments by you for many times already, for some more than 10 times, they already get used to you already. They know how you're insert your needle, and they know the way your treatment works. You feel sad, you feel depressed, you actually transfer your negative energies or chi to the patients too. You don't make the patients feel great. You make the patients feel more, how's it, the worst.
yeah.
Why? How I know this? But do we? I'm not sure how many people know about water, the crystal in water. I forgot. I went to some museums that when you have positive energy, thoughts, emotions, happiness, the way they form the water crystal inside or the snow crystal, I forgot. They use a microscope to take a look. The shape is actually wonderful. In contrast to someone who's like depressed, oh my God, the world is going to come down. Why I brought it to talk to you guys right now? Why I'm doing this podcast? It's different shape, really. Um, I think next podcast I will tell you guys the right informations, the name. Definitely it's a water things they use. When you hold on to the water, you think positive thought, and they maybe freeze it or something. They will see the crystals. I Let me find out the experiments like for you next time. But definitely it's true. If you sit in a room with all people that have depressions, negativity, emotions, you will feel down too. You will not feel that happy. You're like, okay, I have to get the heck out of here. In contrast to meeting people or going to a clinic where my clinic used to be very happy, my patient comes in with a smile. Wow, they even though they're grumpy because of the work, but when they leave out the clinic, they were two different people, and it's not the same person.
Hmm.
They like the way we greet people. I Most of the time I try to be outside to greet them. I don't want to break that connections because it's important to see who's coming in anyway. This way they know that you are caring, not just seeing dollar signs. Most of the patients I know their lifestyles, their name, uh, their work professions. So it's important to be a good mindset. Even though something bad happened uh, in the past, I had death in my family. I still treat my patients. They don't know what's going on. I did not show my emotions. But what I can do? Things happen. I cannot stop the treatments. Plus, because I work under someone, it's not my clinic. If I stop, there's no patient, there's no income coming in. So that's going to be kind of selfish for me to one, don't treat the patient. Two, the loss of incomes for the business. I do want to have some days off, but I can't. I'm the only one who's working back then. Nobody can cover me. But for as a professionalism, you stick to doing what you do best. Try to keep it cool. Things happens, yes, but remember, you're doing this for the other people.
Mm.
You're not doing this for yourself. Yeah, gain money for yourself, but remember, you're doing the treatments. You don't want to have this negativities affect your patients. I'm most of the time I'm good hiding my emotions because of work, because I tend to think of other people than myself. That's one thing that you build bonds with patients better. The patients see that you're not caring, you don't understand, you ask a single questions. That's mean you're not paying attention. That's mean you don't know who they are. You don't know why you still treating them for. One day you could treat them for the leg pain, but they will have back pain because you really doesn't care. If the patient asks, what are you going to say? You might say, "Oh, I'm sorry, I forgot." You cannot say that all the time. Or, "I'm sorry, I don't remember because my mind is not clear because I have problems at home with your spouse or your partners or whatever." You might have to be clear. If a patients have problems with high blood pressures, they're not themselves. But if you're not yourself too, you cannot catch that. I used to work in nursing home. I remember I mentioned this before in one of the podcasts. I have patients who talk so different. Her mental status is different. I noticed that. Why? Because I've been treating her for a while already. I asked her, "Do you change your medications?" She said yes. So her heart medication got changed. I'm not sure if different medication or higher in dosage. The reason I don't know because in nursing home they kept a lot of medical records. I only can see the notes for other doctors to see, the nurses in the progress report. So I don't know the history that well. So I asked her. She said her medication changed. Why? It's because I understand that this person, the way she speaks, the way her actions, the way her routines are not the same after the medications. And the major thing is, at one point she have a suicidal thoughts. If my mind wasn't clear and I really don't want to work in nursing home, really, nursing home is not a great place to work at. Why? Because you see a lot of sadness from patients. But yeah, we our emotions is very crucial for our practice. You don't want to be sad while treating patients. It's best if you just say, "Look, I don't feel well today. Cancel all your patients." Or you let your boss know, "I'm sorry, I don't feel well. Go home." So that's my thinkings about it.
There are a couple things I want to touch on there. Being cordial with the patient and being professional with them goes a long way. Uh, that's not to say that you can't have any emotion whatsoever. You know, a smile goes a long way to someone
Mhm.
who's had a very crappy day. Oh, believe me, you just to have someone, as you were saying, greet you when you walk into the door and you see, that person. Oh, hi, how are you? We've been waiting for you. Come on in. Everything's all set and ready for you. From someone who's had a horrible day and they just want to get away from whatever it is that's been ailing them, whether it's work, whether it's family, whether it's some other type of issue that they've had that day of, somebody cutting them off in the car or something. That's kind of the beginning of healing. That's the beginning of getting better. And they look for that. And if you're going to be professional, be competent about it as well, because you can't just make a mistake and then, shrug it off nonchalantly. You were saying, oh, I was having a bad day or something happens. I remember one of my teachers giving me some very good advice. And she said, never tell your problems to the patient. If your patient asks you how you're doing, you just say, okay. Never say good, never say bad. Don't let them ask any other questions, because you are the health provider, not them. And I had this happened to me once before, because I worked on somebody, and during the conversation, she says, oh, how was your day? And I'm like, oh, it was pretty good. Oh, you're kind of glowing. Did something good happen to you? They're fishing for information. And I'm like, no, it's just another wonderful day. Let's start working on your treatment. Oh, but I'm more interested in why you're so beaming, and why you have such a wide smile. And I'm like, well, and I had to say to her, well, I'm here to help you today. Some people like to kind of turn it around sometimes and think that, oh, well, if you're helping me, I'll try to help you too. You're there to provide a service. I'm not going to say that's it. You're there to provide a service and to help them get better. What's important is taking care of the patient, because once you start getting sidetracked, it'll go on for minutes, hours, and then you're never actually treating the problem that you're there for. I know I'm kind of being vague, but you see this everywhere. It doesn't have to be just in healthcare, your own work, whether it's retail, whether it's restaurant. I mean, just look at bartenders, you know, same idea. They're there, they're talking with you. Now, all of a sudden, the other person wants to connect with you. And now they're starting to ask you personal information. And as a bartender, it's not a good idea to give out personal information. Same with retail. You could have just this little old lady and she'll come up to you and go, oh, my back hurts. And then she'll give you an entire dissertation about why. But you're just really there to stock the shelves. There's really not much you can do about that. If she asks you to go and reach up and grab a can of peas off the top shelf, sure, no problem. But when she starts talking to you for 15 minutes about why she can't reach up, that's preventing you from doing your job too. We're going to wrap this up.
Yeah. Good morning or good night.
Good night. Everybody have a good night, and we'll possibly see you next week.
Thank you for listening. Good night.
And we'll get back to it next time.